Hi, the topic of gut health is very popular. In fact, it is even more popular when we look at dining table conversations. These are conversations that people like to just engage in when they are socializing and chit chatting. But my job as a gastrointestinal surgeon is to try and give you some tangible information that you can take and create a difference in your own life. See, the gut has rightly been called our second brain. The gut has got its own nervous system, which is called the enteric nervous system. But the more important thing that makes the gut so unique is the bacteria. It's the bugs that live in the gut, which is called the gut microbiome. They form their own ecosystem, just like the Amazon rainforest or the Great Barrier Reef. They have created an ecosystem that supports our body, and it does it in ways that we sometimes don't even understand. However, what we do understand is that there are these three key things that this ecosystem of bugs, which is the gut microbiome, that it does for us. Number one, it helps in breaking down the foods that we consume so that the nutrients can be released from that. The second thing it does is it regulates our immune system, keeps us healthy so that we are able to fight infections. But the third thing is something that really intrigues me, and that is it produces these protein molecules, which is called peptides. They are also neurotransmitters, which means they communicate with our brain. And therein lies the power of this term you may have heard, the gut-brain connection. See, many individuals these days experience a condition called as brain fog. Brain fog is something in which the individual is just hazy, they are forgetful, they are not able to focus, and if it is not addressed in its early stages, it progresses to conditions like ADHD, depression, anxiety, panic attacks. Even conditions like ADHD are actually linked to poor gut health. Alzheimer's disease, schizophrenia are some of the other conditions that have been linked to poor gut health. So, what is it that you can do by taking this information and applying it in your own life? And I'll give you just three ideas to think about and to see if you are able to implement it in your own life. The first idea that I have for you is to reduce the consumption of processed foods. And in processed foods, there is one particular ingredient, besides all the things that you hear about sugars and salts and chemicals and pesticides. There is one thing that I'm particularly concerned about, and I talk about a lot with my patients and people who listen to me on the social channels, is the hydrogenated vegetable oils. They are just like poison. They are actually polluting the system and creating more inflammation in the body. You go out to dine in restaurants and other places, most of the cooking is done in vegetable oils, KFCs, Maccas, and other places. And the reason for that is that they are cheap. But whatever is cheap is not necessarily good for you. So try and think about it. Oils like canola oils, palmitate oils, palm oil, which is the same thing, and then rice bran oil. All vegetable oils are hydrogenated and produce trans fats when they are repeatedly heated, and that is what leads to their detrimental potential. The second thing is eat more fiber, not just protein. I went to this restaurant and they asked me, oh, what would you like to have? So I ordered a few vegetables and vegetarian dishes. I'm a plant-based surgeon. And they said, oh, what are you going to have for protein? And I was taken aback a little bit, because for a common consensus or a common thinking is protein equates to steak, chicken, fish. But for someone like myself who's been plant-based now for many years, I pay a lot of attention to the big groups of foods that I consume. And I always try and make sure that I'm getting more fiber, because fiber is the one that actually gives strength to your internal ecosystem, which is this gut microbiome. And the third idea that I want to present to you is that of fasting. I often call them like OMAD days. Now, OMAD days means OMAD, 1 meal a day. The less you consume, the more you are priming your body to actually live longer and healthier and reduce inflammation. This is what allows your body to actually go from a phase of eating, where it has got a lot of digestion to do, to a phase where it is resting and repairing. Because when it is eating, it is busy digesting that food. But when you give a chance for the body to not eat, so it is then resting and repairing your system. So rest time is actually repair time, and that rest time is called fasting. So if you can't do OMAD, which is 1 meal a day, if you can't just do that, then at least try and have the last meal of the day before 6 p.m. So dinners are wrapped up before 6 p.m. Think of these ideas, because you know what? If you don't look after yourself, nobody from outside is coming to look after you and especially make choices for you. Think about it.